reason that wellbeing challenges are continuing in Australia is because we are using models of wellbeing that only look at a part of the picture. It's something a professor at Melbourne University called psychological reductivism. We're often looking at a small number of factors that impact people's well-being instead of taking an evidence-based and authentically holistic view of well-being. Within our model, there are 70 determinants of universal well-being. This sounds like a lot, but the evidence shows that our well-being is impacted by numerous factors. They're not simply psychosocial. They can come from things like being financially insecure. They can come from having a problem in terms of your spiritual state and your belief system. And so we need to extend the model or the lens with which we look at people's universal well-being. And so we're bringing to Australia in the Australian Universal Wellbeing Symposium for the first time an opportunity to look at this newly emerged model. So it was first published in America in 2023, which is quite recent. And from that model development, there's been the development of a universal wellbeing evaluation tool. And the great thing about this is this allows organisations to actually learn about the universal wellbeing profile of all their staff or students, and to actually then give those people the supports or the interventions that they actually need to improve their well-being. And then we can come back around, for example, and we can measure again and check if what we did was effective. So this allows us to set up an inquiry process where we are able to actually shift well-being as it really is, not just work around the edges and look at certain parts of it. And this is where we can make a real impact on well-being across Australia.